Every state and the federal government have laws in place that control both doctors' actions in nursing and home health care, or any setting of health care. We are all sworn in to follow the law. I mean, nurses, they have to have a background check, multiple background checks. There's all kinds of requirements that we have to follow. We have to do things within the scope of our practice, which is defined by the doctors, by the law, okay, of each state. So every nurse is constantly living their experiences with their clinical knowledge, but they're constantly refreshing the laws and procedures that they have to stick to. So they can't, they're watched very closely. And they have to follow and operate within the parameters of their scope of practice. Meaning that's what is expected of us. And the doctor usually dictates that. Or their plan of care dictates that, which is dictated by the doctor. So it's a chain of people following laws and what is normal parameters. If you go out of your scope of practice, then you can get in trouble. One of the jobs of the nurse is observing that the doctor has prescribed certain medication. Okay? That's another job of the nurse. They have to understand that medication, what are its effects, what kind of secondary effects it can have on a patient. What if you're observing a patient that's having a bad breathing sequence, and then the doctor is telling you to give a narcotic? Okay? A narcotic's pain, but it also makes your breathing slow down. It can affect your breathing. So if he's already has a condition, immediate condition with breathing or something, and you feel in your gut that giving them that is going to make that worse, then at that point you have the right to say, I'm withholding this, but you have to follow that chain backwards and say, I feel like it's detrimental to this patient to give this medication because it's going to do this. So therefore you have to communicate with that doctor and let him know. I have the right to say yes. I don't think that medication should be given. Because why? I am an advocate for that patient. If something I feel is going to kill him, I will stop. But if I don't inform anybody as to why I did it, then I can get in trouble. There's a lot of liability in the nursing world, just like doctors. Everybody's liable. It's a very stressful job. Okay, so did I explain myself? If he's not breathing well and then I give him a narcotic and he breathes less, he could have a anoxic brain injury or stop breathing at all, and then his SATs drop and everything, it goes bad. So nurses are advocates. They're also watching like a hawk the patient constantly. It is a very, very responsible, specific job. Nurses can't give their private diagnosis. They can't give their I would do this, because they're liable. That's a doctor's job. And doctors will do it all the time. They'll say, I can't tell you to do that. Because maybe it's not within their scope of practice, within their specialty. It happens all the time. Nurses can't get involved in certain things. They can't give certain opinions, which is okay. I think in certain circumstances it's protective. It's not an easy thing to become a nurse. And there's some pretty dang good ones out there. I've seen nurses tell doctors that they won't do it, whatever he's telling them to do. Then they have to go up the chain of command administratively and their boss has to talk with the doctor and resolve that. There's a certain protocol that has to be followed. Why won't you do that? That's insubordination. Or why I'm giving the order? Why? Because I think it'll kill him. Or why I think that it's going to compromise him or her.